Yes, it's working. Okay. Now we're going to show you. No, your head this side. Because the doctor usually stand at the right side of the patient, so I asked him to put her head on my left. Okay. We're going to we're going to show you the deep palpation on the abdominal. For the deep palpation, first is we should stand by the right side of the patient, and then we should flex your knees. Yeah, flex your knees. Yeah, and then we're going to expose the abdominal. Is it okay? Okay. Yes, expose the area we're going to examine. And when we do abdominal examination, we also start from light palpation. Yes, you can talk with the patient and make him relaxed. So if he is very nervous, then the muscle will be intense, right? So we can warm our hands, especially in winter. And then we can put our hand on his abdominal. They may feel uncomfortable because you are a stranger, but you are the doctor. You are responsible for the physical examination. So before this physical examination, you should make explanation for him why I do this and why this is important for you. Okay, and you can put your hands, your right hand on the abdominal wall. Okay, and we can start the light palpation usually from the left lower conjoint. If we draw a vertical line and a horizontal line and a vertical line through the umbilicus, then we can divide the abdomen into 4 parts, right? So we usually begin our light palpation from the left lower conjoint, right? Okay, light palpation. Do you remember the definition of light palpation? The definition? The depth of light palpation should be within 2 centimeters, okay? So, look, light palpation. It seldom results in tenderness, yes? Okay, and why you do the light palpation on the abdominal? You want to feel the muscle tensity, yes, and the abdominal wall is soft, and but you can still feel some resistance, only a little, right? So under some disease, the abdominal wall may become rigid. So you can feel the normal muscle tense of the abdominal wall, right? Okay, this is the light palpation of the abdomen. The next step is to do what? Deep palpation, deep press palpation. Deep press palpation is usually deeper than 4 to 5 centimeters, right? And you can observe the facial expression of him, right? And you can also ask him, Is it painful or not? No. Okay, here. Also from the left quadrant, left lower quadrant. Okay. And we do the light palpation in a circle at the last, the umbilicus area, right? And for example, the mic burning point, deep press palpation, use 2 or 3 fingers, 2 or 3 fingers, and then press down. Is it clearly on the video? I'm not sure. Can it be seen here? Or maybe. Okay.
No, now you
don't
show me hand. Show my hands. Yeah.
Yes, okay.
Okay. Press it down.
Yeah, now it's okay, now it's okay.
Press down. Pain or not? No? Okay. And the rebound tenderness. This is for the examination of tenderness. For the rebound tenderness, stop for a while when you press down. Stop for at least 2 to 3 seconds. And then remove your hand quickly. If it results in more serious pain, then it's called tenderness, rebound tenderness. Rebound tenderness. And this another example for deep palpation. Deep press palpation is the morphine. You use your left hand. You use the left hand and put your thumb under the right costal margin here, on the middle clavicular line here. The middle clavicular line at the cross of middle clavicular line and the costal margin here. And you ask the patient to breathe in and make the abdominal wall go up. Yes, breathe in, that's right. And the gallbladder will move down to your thumb. Okay, if there is inflammation of gallbladder, then the patient will stop breathing, right? And stop breathing. Okay, this is called the positive morphine sign. Okay, this is another example of deep press palpation. And in deep palpation, there are deep sleeping palpation, right? Deep sleeping palpation and bimanual palpation. So I have shown you the deep press palpation, right? And the examination method for the rebound tenderness. Next one, I will show you how to do deep sleeping palpation. Deep sleeping palpation is to examine the size of the liver and spleen. Okay, and first you should ask the patient to breathe in and breathe out with abdominal up and down. Yes, breathe in and the abdominal wall up, breathe out and abdominal down. Yeah. Then you try to touch the edge of the liver. If there is enlargement of the liver, so the edge of the liver will go downward. Yes. So if you feel the edge of the liver here, maybe 5 centimeters lower the costal margin, then it's called the enlargement of liver, right? Okay, breathe in and out, do the abdominal respiration. Okay. Make sure that your fingers are on the left middle clavicular line. Yes, up and down. Yes, up. Yes, and down. In and out. In and out. In and out. Okay. Then, if your fingers, the forefinger and middle finger, touch the costal margin and feel nothing, it means that there's no enlargement of the liver, right? You can't feel the edge of the liver. And the spleen, similar method. Okay, breathe in. Yes. When the abdominal wall goes down, then press down. Make sure that your hand is always on the wall. And you should move your fingers as the abdominal wall goes up and down. And the trace of your hand should be vertical to the left costal margin. Okay, this. So I have shown you how to do deep press palpation here, and deep sleeping palpation for liver and spleen. And bimanual, very simple. Just use the other hand to put at the back of the organ like this. Okay, to hold. To push the liver up, to make it it's easier for the right hand to touch the edge. Understand? Okay. The same. Yeah. So you should make sure that your nails are too long, because you will add some strength on the abdominal wall. Yes. You use your wrist, like wrist, right? Use your wrist and the interphalangeal joints to move towards the edge. Okay. So you should learn how to use your wrist and interphalangeal joints. And you try to touch the edge of the liver by the radial side of your forefinger and the middle finger. Okay? So this time you should practice the deep press palpation on mic burning point. First one. A second one, you should practice morphosine. Okay, put your thumb on the point of a costal margin and the middle clavicular line, the right middle clavicular line. Okay, and ask him to breathe in, yeah, and observe the facial expression, and you can also ask him. Okay, this is the second task. The third one is very hard. Okay, do light palpation of the abdomen. Okay, first do the light palpation. Second, deep palpation. Okay, deep press palpation, and deep sleeping percussion is very hard. So we will learn that in the abdominal examination. Okay, practice. Practice in groups.